Question 1. The monitoring system demonstrates that a certified sex therapist, CST, is working with a client from a collectivist cultural background, where direct communication about sexual matters is discouraged and family honor is paramount. The client presents with concerns about marital intimacy that are framed within a context of familial obligations and societal expectations rather than individual desire. Which of the following therapeutic adaptations best aligns with ethical and culturally competent practice for this CST? Option A. Incorporate family members into therapy sessions to discuss the marital intimacy concerns, seeking to understand and address the dynamics of familial expectations and obligations within the context of their cultural values. Option B. Focus exclusively on the physiological aspects of sexual dysfunction, avoiding any discussion of emotional or relational components that might be influenced by cultural norms. Option C. Directly address the client's individual sexual desires and explore personal satisfaction, framing the issues within a framework of individual autonomy and self-fulfillment. Option D. Utilize a standardized questionnaire to assess sexual functioning and satisfaction, assuming the client's responses will be comparable to those of clients from more individualistic cultures. The correct answer is C. Directly address the client's individual sexual desires and explore personal satisfaction, framing the issues within a framework of individual autonomy and self-fulfillment. Explanation. This scenario presents a professional challenge due to the inherent complexity of applying therapeutic interventions across diverse cultural backgrounds. The certified sex therapist, CST, must navigate potential misunderstandings, differing communication styles, and varied societal norms surrounding sexuality. Failure to adapt approaches can lead to ineffective treatment, client alienation, and ethical breaches. Careful judgment is required to ensure that interventions are not only clinically sound, but also culturally sensitive and respectful. The correct approach represents best professional practice because it prioritizes client-centered care and adheres to ethical guidelines that mandate cultural competence. Specifically, it aligns with the ethical principles of beneficence and non-maleficence by seeking to do good and avoid harm, which includes avoiding culturally insensitive or inappropriate interventions. It also reflects the professional standard of care that requires therapists to possess and utilize knowledge of cultural factors that may influence sexual health and therapeutic outcomes. This approach demonstrates a commitment to ongoing learning and self-reflection regarding one's own cultural biases and their potential impact on therapy. An incorrect approach that relies solely on a standardized, Western-centric model of sexual health and therapy fails to acknowledge the vast diversity of human experience and cultural expression. This can lead to misinterpretations of client concerns, the imposition of foreign values, and the potential for causing distress or offense. Ethically, this represents a failure to provide competent care and a violation of the principle of respect for persons, which includes respecting their cultural identity. Another incorrect approach that assumes all cultural groups share similar beliefs about sexuality, or that generalizations can be applied without individual assessment, is equally problematic. This demonstrates a lack of understanding of cultural relativism and the importance of individual client narratives within their cultural context. It can result in stereotyping and the delivery of interventions that are irrelevant or even harmful. Professionals should employ a decision-making framework that begins with a thorough cultural assessment of the client, including their beliefs, values, and experiences related to sexuality within their specific cultural context. This involves active listening, open-ended questioning, and a willingness to learn from the client. Therapists should then critically evaluate their own cultural background and potential biases. Interventions should be collaboratively developed with the client, drawing upon evidence-based practices while adapting them to be culturally congruent. Ongoing supervision and consultation with colleagues experienced in cross-cultural therapy can further support effective and ethical practice. Question 2. Research into the role of testosterone levels in female sexual desire has yielded varied results. A client presents with a reported decrease in libido and expresses concern that her testosterone levels might be the primary cause. As a certified sex therapist, what is the most ethically and professionally sound approach to addressing this client's concern? Option A. Educate the client on the current scientific understanding of hormonal influences on female sexual desire, emphasizing that testosterone is one of many potential factors, and explore other contributing psychological, relational, and lifestyle elements in collaboration with her. Option B. Focus exclusively on the potential for low testosterone as the sole explanation for her decreased libido and suggest she seek immediate medical testing for this specific hormone. Option C. Recommend immediate over-the-counter testosterone supplements to address her perceived hormonal deficiency and improve her libido. Option D. Advise the client that her decreased libido is likely a psychological issue and that hormonal factors are not significant contributors to sexual desire in women. The correct answer is A. Educate the client on the current scientific understanding of hormonal influences on female sexual desire, emphasizing that testosterone is one of many potential factors, and explore other contributing psychological, relational, and lifestyle elements in collaboration with her. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified sex therapist, CST, to integrate complex biological information about hormonal influences on sexual behavior with ethical considerations regarding client autonomy and informed consent. The CST must navigate the potential for misinterpretation of scientific findings and avoid making definitive causal links that may oversimplify individual experiences. The challenge lies in presenting nuanced information in a way that empowers the client without pathologizing normal variations in sexual response. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that acknowledges the multifaceted nature of sexual behavior. It emphasizes the CST's role in providing education about potential hormonal influences as one factor among many, alongside psychological, relational, and social determinants. This approach aligns with ethical guidelines that mandate providing accurate, evidence-based information and respecting the client's right to self-determination in understanding and addressing their sexual concerns. It avoids premature conclusions and focuses on collaborative exploration. Incorrect approaches analysis. An approach that focuses solely on prescribing hormonal supplements without a thorough medical evaluation and consultation with a physician fails to adhere to ethical boundaries and professional scope of practice. This bypasses necessary medical oversight and could lead to inappropriate or harmful interventions, violating the principle of do no harm. It also disregards the client's right to informed consent regarding medical interventions, an approach that dismisses the client's concerns about hormonal influences as purely psychological without exploring potential biological contributions is also ethically problematic. This can lead to a failure to provide comprehensive care and may invalidate the client's lived experience. It risks misdiagnosing or undertreating a condition that may have a significant biological component, thereby failing to meet the client's needs effectively. An approach that presents hormonal influences as the sole determinant of sexual behavior, leading to a deterministic view, is an oversimplification that can be harmful. This approach can strip individuals of agency and responsibility for their sexual well-being, potentially leading to feelings of helplessness and resignation. It also fails to acknowledge the complex interplay of factors that contribute to sexual functioning and satisfaction. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and empathic understanding of the client's presenting concerns. This is followed by a thorough biopsychosocial assessment, which includes exploring potential biological factors like hormonal influences, alongside psychological, relational, and environmental factors. The CST should then provide evidence-based education, discussing the current scientific understanding of hormonal influences in a balanced and nuanced manner, highlighting their potential role as one contributing factor among many. Collaboration with other healthcare professionals, such as physicians, is crucial when medical interventions are considered. The ultimate goal is to empower the client with accurate information to make informed decisions about their sexual health and well-being. Question 3. Governance review demonstrates that a certified sex therapist, CST, is working with a client who expresses significant distress regarding their sexual desires, which they believe are inherently sinful and unnatural based on their deeply ingrained religious and cultural upbringing. The client reports experiencing shame and anxiety, impacting their marital intimacy. The CST has identified that the client's desires are within the broad spectrum of human sexuality and do not indicate a clinical disorder, but are in direct conflict with their deeply held beliefs. What is the most ethically and professionally sound approach for the CST to take? Option A. Explore the client's beliefs about sexuality within their religious and cultural context, helping them to understand the origins and impact of these beliefs on their distress, and collaboratively work towards managing their shame and anxiety in a way that respects their values, while also exploring potential avenues for reconciling their desires with their beliefs or finding peace with the conflict. Option B. Acknowledge the client's distress, but inform them that their deeply held religious beliefs are likely the primary cause of their issues, and that the CST cannot effectively help them if they are unwilling to reconsider these beliefs, suggesting they seek spiritual counseling instead. Option C. Focus solely on the physiological aspects of sexual dysfunction, providing techniques to improve marital intimacy without addressing the underlying conflict between the client's desires and their religious beliefs, as this is a personal matter outside the scope of sexual therapy. Option D. Educate the client on the scientific and psychological understanding of human sexuality, emphasizing that their desires are normal and not inherently sinful, and encourage them to challenge their religious beliefs to align with a more modern, evidence-based perspective on sexual health. The correct answer is A. Explore the client's beliefs about sexuality within their religious and cultural context, helping them to understand the origins and impact of these beliefs on their distress, and collaboratively work towards managing their shame and anxiety in a way that respects their values, while also exploring potential avenues for reconciling their desires with their beliefs or finding peace with the conflict. Explanation. This scenario presents a professional challenge due to the intersection of a client's deeply personal beliefs, potential cultural influences on their understanding of sexuality, and the certified sex therapist's CST ethical obligation to provide evidence-based, client-centered care. The CST must navigate potential cultural relativism while upholding professional standards and avoiding imposing personal values. The core of the challenge lies in distinguishing between culturally influenced perspectives on sexuality and potential indicators of distress or dysfunction that warrant therapeutic intervention. The correct approach represents best professional practice because it prioritizes a comprehensive, culturally sensitive assessment. This involves actively seeking to understand the client's worldview, including their cultural and religious background, and how these inform their understanding of sexual health and relationships. It acknowledges that normal sexual expression can vary across cultures, and that the CST's role is to facilitate the client's well-being within their own framework, not to impose an external standard. This aligns with ethical guidelines that emphasize cultural competence, respect for client autonomy, and the avoidance of harm. The CST's commitment to ongoing education in diverse sexualities and cultural contexts is also paramount. An incorrect approach that focuses solely on a Western, biomedical model of sexual health without acknowledging cultural nuances would be ethically problematic. This failure to engage in cultural humility risks pathologizing normal variations in sexual expression and can lead to misdiagnosis and ineffective treatment. It violates the principle of client-centered care and can create a power imbalance where the therapist's cultural assumptions dominate. Another incorrect approach that dismisses the client's stated beliefs as solely a product of cultural conditioning without further exploration would be equally problematic. This approach fails to respect the client's lived experience and can alienate them from therapy. It also overlooks the possibility that deeply held beliefs, even if culturally influenced, are integral to the client's identity and well-being. A third incorrect approach that attempts to correct the client's beliefs based on the therapist's own understanding of ideal sexual functioning would be a clear violation of ethical boundaries and professional neutrality. This imposes personal values and biases, undermining the therapeutic alliance and potentially causing significant harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Self-awareness. Recognize personal biases and cultural assumptions regarding sexuality. 2. Cultural humility. Approach the client's perspective with genuine curiosity and a willingness to learn rather than assuming expertise. 3. Comprehensive assessment. Gather information about the client's sexual history, relationship dynamics, and beliefs, explicitly inquiring about cultural, religious, and familial influences. 4. Client-centered goal setting. Collaborate with the client to define therapeutic goals that are meaningful and achievable within their own value system. 5. Evidence-based practice with cultural adaptation. utilize therapeutic modalities that are supported by evidence, but adapt their application to be culturally relevant and sensitive. 6. Consultation and supervision. Seek guidance from supervisors or colleagues when encountering complex ethical or cultural dilemmas. 7. Ongoing education. Continuously engage in learning about diverse sexualities, cultural perspectives, and ethical best practices. Question 4. The efficiency study reveals that when addressing a client's concerns about sexual function, a certified sex therapist's approach to explaining the anatomy and physiology of sexual organs significantly impacts therapeutic outcomes. Which of the following approaches to explaining anatomical and physiological details of sexual organs is most aligned with best professional practice for a CST? Option A. Utilizing highly technical medical terminology and detailed anatomical diagrams to ensure the client receives the most precise and comprehensive scientific information available. Option B. Focusing on the psychological aspects of sexual response while minimizing detailed discussion of the physical anatomy, as the primary goal is emotional well-being. Option C. Offering generalized descriptions of sexual organ functions without specific reference to the client's individual anatomy or reported experiences, assuming a baseline level of understanding. Option D. Providing clear, accessible, and non-judgmental explanations of the relevant anatomy and physiology, tailored to the client's expressed understanding and concerns, using language that is both accurate and sensitive. The correct answer is D. Providing clear, accessible, and non-judgmental explanations of the relevant anatomy and physiology, tailored to the client's expressed understanding and concerns, using language that is both accurate and sensitive. Explanation. This scenario is professionally challenging because it requires a certified sex therapist, CST, to navigate the intersection of anatomical knowledge and client-centered care, ensuring that information provided is both accurate and delivered in a way that respects the client's individual experience and potential sensitivities. The CST must demonstrate a nuanced understanding of the anatomy and physiology of sexual organs, not just as biological structures, but as integral components of a client's sexual health and well-being. Careful judgment is required to tailor explanations to the client's level of understanding and emotional state, avoiding overly clinical or detached language that could alienate or shame the client. The correct approach represents best professional practice because it prioritizes accurate, accessible, and client-affirming education. By focusing on clear, non-judgmental explanations of the anatomy and physiology of sexual organs relevant to the client's concerns, the CST fosters a safe and trusting therapeutic environment. This aligns with ethical guidelines that mandate competence, beneficence, and respect for client autonomy. Specifically, it upholds the principle of providing accurate information to empower clients to understand their bodies and make informed decisions about their sexual health. This approach directly supports the CST's role in facilitating sexual health and addressing sexual concerns with evidence-based knowledge. An incorrect approach that relies solely on complex medical terminology without considering the client's comprehension fails ethically and professionally. This can lead to client confusion, anxiety, and a breakdown in the therapeutic alliance, potentially violating the principle of beneficence by not truly helping the client. It also risks alienating the client, which is contrary to the ethical imperative of creating a supportive and non-judgmental space. Furthermore, it demonstrates a lack of competence in client communication, a crucial aspect of sex therapy. Another incorrect approach that involves making assumptions about the client's existing knowledge or experience with their own anatomy is also professionally unacceptable. This can lead to providing irrelevant or overwhelming information, or worse, inadvertently reinforcing harmful myths or misconceptions. It disregards the client's unique journey and can be perceived as dismissive or patronizing, undermining the therapeutic relationship and failing to meet the client's specific needs. A further incorrect approach that focuses on generalized, abstract descriptions of sexual organs without connecting them to the client's specific concerns or experiences fails to be therapeutically effective. While anatomically correct, such information lacks practical application for the client's immediate issues, rendering the educational component less impactful and potentially wasting valuable therapeutic time. This approach neglects the core principle of tailoring interventions to individual client needs. The professional decision-making process for similar situations should involve a continuous assessment of the client's engagement and understanding. This includes actively listening to the client's questions and concerns, gauging their level of comfort with the information being presented, and being prepared to adjust the language and depth of explanation accordingly. A skilled CST will employ a client-centered approach, using analogies or visual aids if appropriate, and regularly checking for comprehension to ensure the educational component of therapy is both accurate and beneficial. Question 5. Which approach would be most appropriate for a certified sex therapist, CST, when a client, while discussing their current relationship difficulties and low libido, discloses a history of childhood sexual abuse that they believe is directly contributing to their sexual dysfunction? Option A. Focus exclusively on the presenting sexual symptoms and relationship dynamics, advising the client to seek separate therapy for their trauma history, without exploring the potential connections between the trauma and their current sexual concerns. Option B. Validate the client's disclosure, prioritize establishing a strong sense of safety and trust, and collaboratively develop a treatment plan that integrates trauma-informed principles with sex therapy goals, potentially involving phased trauma processing as the client gains stability and readiness. Option C. Acknowledge the disclosure briefly, but quickly redirect the conversation back to the immediate sexual concerns, suggesting that past experiences are less relevant to current sexual functioning than behavioral changes. Option D. Immediately initiate detailed trauma processing techniques to address the root cause of the sexual dysfunction, assuming that resolving the past trauma will automatically resolve the current sexual issues. The correct answer is B. Validate the client's disclosure, prioritize establishing a strong sense of safety and trust, and collaboratively develop a treatment plan that integrates trauma-informed principles with sex therapy goals, potentially involving phased trauma processing as the client gains stability and readiness. Explanation. This scenario presents a common challenge in sex therapy, navigating a client's disclosure of past trauma that may intersect with their current sexual concerns and relationship dynamics. The therapist must balance the immediate need to address the client's distress with the long-term goal of facilitating healing and integration. The professional challenge lies in determining the most ethically sound and therapeutically effective intervention without re-traumatizing the client or overstepping professional boundaries. The correct approach, which involves validating the client's experience, establishing safety, and collaboratively developing a treatment plan that integrates trauma processing with sex therapy goals, represents best professional practice. This aligns with ethical guidelines that prioritize client well-being, informed consent, and a phased approach to trauma work. Specifically, it adheres to principles of trauma-informed care, which emphasize safety, trustworthiness, choice, collaboration, and empowerment. By validating the client's disclosure and ensuring a sense of safety, the therapist builds rapport and trust, essential for effective therapeutic work. Integrating trauma processing into the broader sex therapy goals ensures a holistic approach to the client's presenting issues. An incorrect approach that immediately dives into detailed trauma processing without first establishing safety and a clear treatment plan risks re-traumatization. This failure to prioritize client safety and a phased approach is an ethical lapse, potentially violating principles of non-maleficence. Another incorrect approach, focusing solely on the sexual symptoms without acknowledging or addressing the underlying trauma, is also ethically problematic. It fails to provide comprehensive care and may leave the client's core issues unaddressed, potentially leading to symptom recurrence or exacerbation. A third incorrect approach, referring the client to a different specialist without adequate assessment or a clear rationale, could be seen as abandonment if not handled with sensitivity and a clear transition of care, especially if the client has already disclosed sensitive information. Professionals should approach such situations by first actively listening and validating the client's disclosure, ensuring they feel heard and understood. The next step is to assess the client's current level of distress and their capacity to engage in trauma processing. A collaborative discussion about treatment goals and the proposed therapeutic approach, including the integration of trauma work, is crucial for informed consent. The therapist should then develop a phased treatment plan that prioritizes safety and stabilization before moving into deeper trauma processing, always ensuring the client's pace and comfort are respected. Question 6. The review process indicates that a certified sex therapist, CST, is working with a client who expresses distress related to their sexual identity, which appears to be in conflict with the deeply conservative religious and cultural norms of their close-knit community. The CST needs to determine the most appropriate therapeutic approach to address the client's distress while respecting their autonomy and cultural background. Which of the following approaches best aligns with the ethical and professional standards for a CST? Option A. Primarily focus on the client's internal psychological experience, assuming that resolving internal conflicts will naturally lead to a resolution of external societal pressures, and avoid direct discussion of community norms to prevent alienating the client. Option B. Encourage the client to distance themselves from their community and cultural background to reduce the influence of conflicting norms on their sexual identity exploration. Option C. Prioritize challenging the client's community's conservative religious and cultural norms regarding sexuality, aiming to educate community members about diverse sexual identities and advocate for broader acceptance. Option D. Focus on exploring the client's internal feelings and desires related to their sexual identity, while also facilitating a discussion about the specific sociocultural pressures and expectations they are experiencing from their community, and collaboratively developing strategies to navigate these influences. The correct answer is D. Focus on exploring the client's internal feelings and desires related to their sexual identity, while also facilitating a discussion about the specific sociocultural pressures and expectations they are experiencing from their community, and collaboratively developing strategies to navigate these influences. Explanation. This scenario presents a professional challenge because it requires a certified sex therapist, CST, to navigate the complex interplay between an individual's personal sexual identity and the deeply ingrained sociocultural norms of their community. The CST must balance the ethical imperative to support client autonomy and self-determination with the potential for societal stigma or discrimination that may arise from exploring or expressing certain sexual identities. Careful judgment is required to ensure that therapeutic interventions are culturally sensitive, client-centered, and do not inadvertently reinforce harmful stereotypes or create undue risk for the client. The correct approach represents best professional practice because it prioritizes a comprehensive, client-led exploration of identity within its sociocultural context. This aligns with ethical guidelines that emphasize cultural competence, respect for diversity, and the avoidance of imposing personal biases. By actively seeking to understand the client's lived experience, including the specific cultural narratives and expectations surrounding sexuality in their community, the CST can facilitate a more nuanced and empowering therapeutic process. This approach respects the client's right to define their own sexuality, while also acknowledging the external factors that shape their experiences and choices. It is grounded in the principle of beneficence, aiming to promote the client's well-being by addressing all relevant influences on their sexual health and identity. An incorrect approach that focuses solely on the client's internal experience without acknowledging or exploring the impact of their sociocultural environment would be professionally unacceptable. This failure would violate the principle of cultural competence, as it neglects to consider the significant influence of societal norms, values, and potential prejudices on an individual's sexual identity and expression. Such an approach risks pathologizing the client's experiences if their identity clashes with dominant cultural narratives, rather than understanding it as a product of complex interactions. Another incorrect approach that involves directly challenging or attempting to change the client's community's sociocultural norms would also be professionally unacceptable. This oversteps the boundaries of the therapeutic relationship, which is focused on the individual client's well-being and self-exploration, not on societal reform. It could lead to ethical breaches related to competence and scope of practice, as the CST is not equipped or authorized to alter community-level beliefs. Furthermore, it could alienate the client and create a hostile therapeutic environment, undermining trust and progress. A professional decision-making process for similar situations should begin with a thorough assessment of the client's presenting concerns, paying close attention to any mention of cultural or societal factors influencing their sexuality. The CST should then engage in active listening and empathetic inquiry to understand the client's perception of these influences. This involves asking open-ended questions about their cultural background, family expectations, religious beliefs, and community attitudes towards sexuality. The therapist should also engage in self-reflection to identify any personal biases or assumptions that might impact their understanding. The therapeutic goals should be collaboratively established with the client, ensuring that interventions are tailored to their unique needs and cultural context, always prioritizing client safety, autonomy, and well-being. Question 7. The analysis reveals that a client presents with persistent difficulties achieving and maintaining penile erection sufficient for satisfactory sexual intercourse, reporting a gradual onset over the past year. The client denies significant relationship distress or overt psychological symptoms such as depression or anxiety. When considering the neurobiology of sexual response, which of the following assessment priorities would best guide the certified sex therapist's initial risk assessment and intervention planning? Option A. Evaluating the client's understanding of the physiological mechanisms of erection and identifying potential disruptions in the nitric oxide pathway or vascular flow. Option B. Focusing exclusively on the client's communication patterns with their partner and exploring any underlying performance anxiety. Option C. Recommending immediate consultation with a urologist for a comprehensive medical workup, including hormone level testing. Option D. Exploring the client's early life experiences and attachment history to uncover potential psychosexual developmental issues. The correct answer is A. Evaluating the client's understanding of the physiological mechanisms of erection and identifying potential disruptions in the nitric oxide pathway or vascular flow. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified sex therapist, CST, to integrate complex neurobiological understanding of sexual response into their risk assessment for a client presenting with potential psychosexual dysfunction. The challenge lies in accurately identifying the most probable contributing factors to the client's reported issues, distinguishing between potential neurological underpinnings and psychological or relational dynamics, and formulating a safe and effective intervention plan that respects the client's autonomy and the scope of practice for a CST. Misinterpreting neurobiological signals could lead to inappropriate referrals, delayed or ineffective treatment, or even iatrogenic harm. Correct approach analysis. The correct approach involves a comprehensive assessment that prioritizes understanding the client's subjective experience and observable behaviors, while also considering potential neurobiological influences on sexual response. This aligns with best professional practice for CSTs, which mandates a holistic and evidence-based approach. Specifically, CST must adhere to ethical guidelines that require competence in assessment and intervention, including recognizing when to consult with or refer to other medical professionals. The focus on identifying patterns of neural activation and neurotransmitter involvement as they relate to the client's specific symptoms, e.g., delayed arousal, difficulty with orgasm, is crucial for differential diagnosis and tailoring therapeutic strategies. This approach respects the client's right to informed consent and ensures that interventions are grounded in a thorough understanding of the underlying mechanisms of sexual response, as supported by current scientific literature relevant to the field of sex therapy. Incorrect approaches analysis. One incorrect approach would be to solely focus on psychological or relational factors without adequately considering the potential neurobiological underpinnings. This fails to meet the ethical obligation of a CST to conduct a thorough assessment that explores all relevant contributing factors to sexual dysfunction. It risks misdiagnosing the issue, leading to ineffective psychotherapeutic interventions and potentially delaying necessary medical evaluation or treatment for underlying neurological conditions. This approach also violates the principle of beneficence by not providing the most appropriate care. Another incorrect approach would be to overemphasize neurobiological explanations and immediately recommend pharmacological interventions or extensive medical testing without a foundational psychosexual assessment. This oversteps the scope of practice for a CST, who is not a medical doctor and cannot prescribe medication or independently diagnose medical conditions. Such an approach could lead to unnecessary medicalization of the client's experience, potential side effects from inappropriate medication, and a failure to address the psychological and relational components that are often integral to sexual well-being. This constitutes a failure to adhere to professional boundaries and ethical guidelines regarding referrals and interdisciplinary collaboration. A further incorrect approach would be to dismiss the client's reported symptoms as purely psychosomatic without exploring the possibility of neurobiological contributions. This demonstrates a lack of clinical curiosity and a failure to apply a comprehensive understanding of sexual response. It can lead to a dismissive attitude towards the client's experience, potentially damaging the therapeutic alliance and failing to identify treatable neurobiological causes of sexual dysfunction. This violates the ethical principle of non-maleficence by potentially causing psychological distress through invalidation. Professional reasoning. Professionals should employ a systematic decision-making process that begins with active listening and empathic engagement with the client's presenting concerns. This is followed by a comprehensive assessment that explores psychological, relational, and biological factors contributing to sexual dysfunction. When neurobiological influences are suspected, the CST should utilize their knowledge of the neurobiology of sexual response to formulate hypotheses, which then guides the decision of whether further assessment by a medical professional is warranted. This involves understanding the client's symptomology in the context of known neurobiological pathways and neurotransmitter functions involved in arousal, desire, and orgasm. The CST must then clearly communicate their assessment and recommendations to the client, including the rationale for any referrals, ensuring informed consent throughout the process. Collaboration with other healthcare providers is essential when medical or neurological issues are suspected or diagnosed. Question 8. Benchmark analysis indicates that a certified sex therapist, CST, is working with a client who has developed romantic feelings towards the therapist, which the client has disclosed. The CST recognizes the importance of maintaining professional boundaries and the potential for harm if these boundaries are crossed. Considering the ethical framework and regulatory guidelines governing CSTs, what is the most appropriate course of action for the therapist in this situation? Option A. Immediately terminate therapy without further discussion or referral, as the disclosure of romantic feelings creates an insurmountable ethical conflict. Option B. Acknowledge the client's feelings and suggest exploring the possibility of a romantic relationship after therapy concludes to see if there is potential for a connection outside of the professional setting. Option C. Continue therapy as usual, ignoring the client's disclosure of romantic feelings, assuming that focusing on the original therapeutic goals will eventually resolve the issue. Option D. Gently but firmly reaffirm professional boundaries. Explore the client's feelings within the therapeutic context to understand their meaning and impact on therapy, and assess if therapy can continue effectively. If not, plan for appropriate termination and referral. The correct answer is D. Gently but firmly reaffirm professional boundaries. Explore the client's feelings within the therapeutic context to understand their meaning and impact on therapy, and assess if therapy can continue effectively. If not, plan for appropriate termination and referral. Explanation. This scenario presents a professional challenge due to the inherent power imbalance in the therapeutic relationship and the potential for dual relationships to compromise objectivity and client welfare. A certified sex therapist, CST, must navigate these complexities with strict adherence to ethical codes and regulatory guidelines to maintain professional boundaries and ensure client safety. The correct approach, which involves maintaining strict professional boundaries and avoiding any form of personal or romantic involvement, represents best professional practice. This aligns with the ethical principles of professional conduct for CSTs, which universally prohibit dual relationships that could exploit the client, impair professional judgment, or harm the client. Specifically, ethical codes emphasize the therapist's responsibility to avoid relationships that could interfere with the effective and objective provision of services. This includes refraining from romantic or sexual relationships with current or former clients for a specified period, as defined by professional standards, to allow for the resolution of transference and countertransference issues, and to prevent exploitation. An incorrect approach that involves exploring the possibility of a romantic relationship with the client is a severe ethical and regulatory failure. This directly violates the core tenets of professional boundaries, risking exploitation of the client's vulnerability and the therapeutic alliance. Such an action would constitute a breach of trust and could lead to significant psychological harm to the client, as well as disciplinary action from regulatory bodies. Another incorrect approach, which might involve delaying the termination of therapy solely to avoid addressing the client's expressed romantic feelings, also represents a failure. A CST must handle such disclosures with sensitivity, prolonging therapy unnecessarily when it is no longer clinically indicated, or when the therapeutic relationship is compromised by the client's romantic interest, can be exploitative. Ethical guidelines require therapists to terminate services when they are no longer beneficial to the client or when the client's romantic interest impedes therapeutic progress. A third incorrect approach, such as immediately terminating therapy without a proper clinical assessment of the impact on the client or without providing appropriate referrals, could also be problematic. While maintaining boundaries is crucial, abrupt termination, without considering the client's needs and ensuring continuity of care, can be detrimental. Ethical practice dictates a thoughtful and client-centered approach to termination, even in situations involving boundary challenges. A professional decision-making process for similar situations should involve a thorough assessment of the client's needs and the therapeutic relationship. This includes consulting relevant ethical codes and seeking supervision or consultation from experienced colleagues. The primary consideration must always be the client's well-being and the integrity of the therapeutic process. When faced with a client's romantic or sexual feelings, the CST should address these feelings directly within the therapeutic context, explore their meaning for the client, and assess their impact on the therapy. If the therapeutic relationship is compromised or if the therapist's objectivity is threatened, termination and referral, handled ethically and professionally, are often necessary. Question 9. Benchmark analysis indicates that a client presents with a gradual onset of difficulty achieving orgasm during partnered sexual activity, which they report has been occurring for the past 6 months. The client denies any prior history of sexual dysfunction and reports no significant medical conditions or current medication use that would typically impact sexual response. They describe a generally positive relationship with their partner and no significant interpersonal conflicts. Based on this information, which of the following diagnostic considerations is most appropriate for a certified sex therapist to prioritize in their initial assessment? Option A. Prioritize a physiological workup to rule out an underlying medical condition, despite the client's denial of relevant health issues. Option B. Conclude that the dysfunction is purely psychological and focus solely on cognitive behavioral interventions. Option C. Focus on exploring potential secondary anorgasmia, considering recent life stressors and relational dynamics that may have emerged. Option D. Immediately investigate for primary anorgasmia, assuming a lifelong underlying issue despite the recent onset. Correct answer is C. Focus on exploring potential secondary anorgasmia, considering recent life stressors and relational dynamics that may have emerged. Explanation. This scenario presents a professional challenge due to the nuanced presentation of sexual dysfunction, requiring a certified sex therapist, CST, to differentiate between primary and secondary causes, and to consider the interplay of psychological, physiological, and relational factors. Accurate diagnosis is paramount for effective treatment planning and adherence to ethical standards of care. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that aligns with the ethical guidelines for CSTs. This involves a thorough differential diagnosis, considering all potential contributing factors to the client's reported difficulties. It acknowledges that sexual dysfunction is often multifactorial and requires a holistic understanding of the individual and their relational context. This approach ensures that treatment is tailored to the specific underlying causes, maximizing the likelihood of positive outcomes and upholding the client's well-being. Adherence to professional standards of practice, which emphasize thorough assessment and individualized care, is a core ethical obligation for CSTs. An incorrect approach that focuses solely on a single potential cause without adequate exploration fails to meet the standard of care. For example, attributing the dysfunction solely to a psychological factor without investigating potential physiological contributors could lead to misdiagnosis and ineffective treatment, potentially causing harm to the client. This would be a failure to conduct a comprehensive assessment as mandated by ethical guidelines. Similarly, an approach that prematurely labels the dysfunction without considering the client's subjective experience and relational dynamics overlooks crucial diagnostic information and could result in a superficial understanding of the problem. This demonstrates a lack of clinical rigor and an ethical lapse in failing to provide a complete and accurate assessment. Professionals should employ a systematic decision-making process that begins with active listening and empathic engagement with the client's presenting concerns. This is followed by a detailed history-taking, encompassing sexual, medical, psychological, and relational factors. A differential diagnosis should then be formulated, considering various types of sexual dysfunction and their potential etiologies. Treatment planning should be collaborative, evidence-based, and individualized, with ongoing assessment to monitor progress and adjust interventions as needed. This iterative process ensures that the client receives the most appropriate and effective care. Question 10. During the evaluation of a client presenting with persistent difficulties in achieving sexual satisfaction, the client expresses significant discomfort and reluctance when the certified sex therapist, CST, gently probes the potential influence of early life experiences and attachment patterns on their current sexual functioning. The client states, "I just want to have better sex. I don't want to dig into all that old stuff." Which of the following approaches best reflects ethical and effective practice in this situation? Option A. Focus exclusively on behavioral techniques and exercises aimed at improving sexual arousal and performance, deferring any discussion of psychological factors until the client expresses readiness. Option B. Gently but firmly insist on exploring early life experiences and attachment patterns immediately, explaining that these are foundational to sexual satisfaction and that progress will be limited without addressing them directly. Option C. Acknowledge the client's immediate concern and resistance, and propose a phased approach that begins with psychoeducation on the mind-body connection in sexuality, and gradually introduces exploration of psychological factors as trust and comfort increase, ensuring the client feels in control of the pace of exploration. Option D. Suggest that the client might not be ready for sex therapy and recommend they seek individual psychotherapy to address their resistance to exploring psychological issues before returning to sex therapy. The correct answer is C. Acknowledge the client's immediate concern and resistance, and propose a phased approach that begins with psychoeducation on the mind-body connection in sexuality and gradually introduces exploration of psychological factors as trust and comfort increase, ensuring the client feels in control of the pace of exploration. Explanation. This scenario presents a professional challenge due to the intersection of a client's deeply ingrained psychological patterns, potentially stemming from early life experiences, and their current sexual functioning. The certified sex therapist, CST, must navigate the client's resistance to exploring the underlying psychological roots of their sexual difficulties, which could be a defense mechanism or a reflection of shame and fear. The CST's primary ethical and professional obligation is to provide client-centered care that prioritizes the client's well-being and autonomy, while adhering to established therapeutic best practices. The correct approach involves a phased, client-led exploration that gradually builds trust and safety. This method acknowledges the client's current discomfort and resistance while gently guiding them towards understanding the psychological underpinnings of their sexual concerns. This aligns with ethical guidelines that emphasize informed consent, therapeutic alliance, and a non-coercive approach to treatment. By validating the client's feelings and offering a structured, yet flexible, path forward, the CST fosters a strong therapeutic relationship, which is crucial for addressing complex psychological issues related to sexuality. This approach respects the client's pace and readiness for deeper exploration, thereby promoting long-term positive outcomes and preventing potential iatrogenic harm. An incorrect approach would be to immediately push for a deep dive into past trauma or early developmental issues without adequate preparation or client consent. This could be perceived as intrusive and overwhelming, potentially leading to client withdrawal, increased resistance, or even re-traumatization. Ethically, this violates the principle of do no harm and fails to establish a secure therapeutic foundation. Another incorrect approach would be to solely focus on behavioral techniques or symptom management without addressing the underlying psychological factors. While behavioral interventions can be helpful, neglecting the psychological roots can lead to superficial or temporary improvements, failing to achieve lasting change, and potentially missing critical contributing factors to the client's distress. This approach might also be seen as a failure to provide comprehensive care, which is expected of a CST. Professionals should approach such situations by first establishing a strong therapeutic alliance, characterized by empathy, active listening, and non-judgment. They should then collaboratively develop a treatment plan that respects the client's readiness and pace, gradually introducing exploration of psychological factors as trust and safety are built. This involves psychoeducation about the mind-body connection in sexuality and the potential impact of psychological experiences. Decision-making should be guided by ongoing assessment of the client's response, flexibility in adapting intervention, and a commitment to ethical principles of beneficence, non-maleficence, autonomy, and justice. Question 11. Risk assessment procedures indicate a client presenting with erectile dysfunction, ED, has not yet consulted a physician to rule out underlying medical causes. Which of the following represents the most appropriate initial step for a certified sex therapist, CST, in this situation? Option A. Strongly encourage the client to seek a comprehensive medical evaluation from a physician to investigate potential physical causes of the ED before proceeding with sex therapy interventions. Option B. Recommend specific over-the-counter supplements known to support erectile function, pending further discussion. Option C. Advise the client that ED is a common issue and offer immediate sex therapy techniques to manage symptoms without medical consultation. Option D. Begin exploring the psychological and relational factors contributing to the ED, assuming it is primarily psychosomatic in nature. The correct answer is A. Strongly encourage the client to seek a comprehensive medical evaluation from a physician to investigate potential physical causes of the ED before proceeding with sex therapy interventions. Explanation. This scenario is professionally challenging because it requires the certified sex therapist, CST, to navigate the complex interplay between a client's physical health, psychological well-being, and sexual functioning, all within the ethical and regulatory boundaries of their practice. The CST must avoid making medical diagnoses or prescribing treatments, which fall outside their scope of practice, while still providing comprehensive and supportive sexual health care. The correct approach represents best professional practice because it prioritizes a holistic understanding of the client's erectile dysfunction, ED, by integrating information from medical professionals and focusing on the psychological and relational aspects that a CST is qualified to address. This aligns with ethical guidelines that mandate collaboration with other healthcare providers when a client's condition may have medical underpinnings, ensuring the client receives appropriate care without the CST overstepping their professional boundaries. This approach upholds the principle of beneficence by seeking the best outcome for the client through a coordinated care model. An incorrect approach that involves the CST attempting to diagnose the underlying cause of the ED or recommending specific pharmaceutical interventions would represent a significant regulatory and ethical failure. This constitutes practicing medicine without a license, which is illegal and unethical. It also violates the principle of non-maleficence by potentially delaying or interfering with appropriate medical diagnosis and treatment, and it breaches professional competence by engaging in activities outside the scope of sex therapy. Another incorrect approach, such as solely focusing on psychological factors without acknowledging the potential for medical causes, and without encouraging medical consultation, fails to provide a comprehensive risk assessment and could lead to suboptimal client outcomes by ignoring critical physical health aspects. This demonstrates a lack of due diligence and a failure to adhere to best practices in integrated care. Professionals should employ a decision-making framework that begins with a thorough intake and assessment, identifying presenting concerns and potential contributing factors. If ED is reported, the initial step should always involve assessing for any potential medical etiologies and strongly encouraging the client to seek a medical evaluation from a qualified physician. The CST's role then becomes to explore the psychological, relational, and behavioral aspects of the ED, working collaboratively with the client and their medical team. This involves active listening, empathetic inquiry, and the application of evidence-based sex therapy interventions, while consistently respecting the boundaries of their professional scope and collaborating with other healthcare providers. Question 12. System analysis indicates that a client presents with persistent difficulties achieving and maintaining sufficient sexual arousal, reporting distress related to these experiences. The client has a history of a chronic medical condition managed with medication and has recently experienced a significant life stressor. The CST is tasked with determining the most appropriate initial therapeutic strategy. Which of the following approaches best aligns with the ethical and professional standards for a certified sex therapist? Option A. Initiate a comprehensive biopsychosocial assessment to explore potential physiological, psychological, relational, and contextual factors contributing to the arousal difficulties, and collaboratively develop a treatment plan that may include psychoeducation, sensate focus exercises, and communication skills training, with a referral for medical evaluation if indicated. Option B. Advise the client to discontinue their current medication for the chronic medical condition, as it may be impacting their sexual function, without consulting their prescribing physician. Option C. Immediately focus on cognitive restructuring techniques to address any negative self-talk or performance anxiety related to sexual arousal, assuming the primary cause is psychological. Option D. Recommend over-the-counter supplements known to enhance libido, as these are generally safe and can be a quick solution for arousal issues. The correct answer is A. Initiate a comprehensive biopsychosocial assessment to explore potential physiological, psychological, relational, and contextual factors contributing to the arousal difficulties, and collaboratively develop a treatment plan that may include psychoeducation, sensate focus exercises, and communication skills training, with a referral for medical evaluation if indicated. Explanation. This scenario presents a common challenge in sex therapy where a client presents with a complex interplay of physical, psychological, and relational factors contributing to female sexual arousal disorder, FSAD. The professional challenge lies in accurately assessing the multifactorial nature of FSAD and differentiating between potential underlying causes, ensuring that the chosen therapeutic approach is evidence-based, client-centered, and adheres to the ethical guidelines and scope of practice for certified sex therapists, CST. Careful judgment is required to avoid premature diagnostic conclusions or the application of interventions that fall outside the CST's expertise, potentially causing harm or delaying effective treatment. The correct approach represents best professional practice because it prioritizes a comprehensive biopsychosocial assessment. This aligns with the ethical mandate for CSTs to engage in thorough evaluation before initiating treatment, ensuring that interventions are tailored to the individual's specific needs and contributing factors. It respects the client's autonomy by involving them in the treatment planning process and emphasizes collaboration with other healthcare professionals when indicated, which is a cornerstone of ethical and effective care. This approach is supported by the general principles of ethical practice for sex therapists, which advocate for evidence-based interventions and a holistic understanding of sexual health. An incorrect approach that focuses solely on a single potential cause, such as a purely psychological explanation without considering physiological factors, fails to meet the comprehensive assessment requirement. This could lead to ineffective treatment and a violation of the ethical duty to provide competent care. Another incorrect approach that involves prescribing medication without being a licensed medical prescriber constitutes practicing outside the scope of a CST's license and expertise, posing significant ethical and legal risks. A third incorrect approach that dismisses the client's concerns or offers simplistic solutions without a thorough assessment demonstrates a lack of professional diligence and empathy, violating the ethical obligation to treat clients with respect and to provide appropriate therapeutic services. The professional reasoning process for similar situations should involve a systematic approach. First, conducting a detailed history that explores sexual, medical, psychological, and relational factors. Second, utilizing validated assessment tools where appropriate. Third, collaboratively developing a treatment plan with the client, outlining clear goals and interventions. Fourth, regularly evaluating the client's progress and adjusting the treatment plan as needed. Finally, recognizing the limits of one's own expertise and seeking consultation or referral to other professionals, e.g., physicians, gynecologists, psychiatrists, couples therapists, when the client's needs extend beyond the CST's scope of practice. This iterative process ensures that the client receives the most appropriate and effective care. Question 13. Regulatory review indicates that a certified sex therapist, CST, is working with a client presenting with new-onset erectile dysfunction and decreased libido. The client reports no significant changes in lifestyle, diet, or stress levels, and denies any history of psychological trauma directly related to sexual activity. Given these presenting concerns, what is the most appropriate initial course of action for the CST to ensure comprehensive and ethical client care? Option A. Recommend a comprehensive medical evaluation by a physician to rule out underlying physiological causes, followed by a detailed psychological evaluation by the CST to assess for psychological contributors. Option B. Advise the client to focus on stress reduction techniques and lifestyle changes, postponing any formal medical or psychological evaluation Option C. Immediately initiate a series of psychological interventions focused on performance anxiety and relationship dynamics, assuming the symptoms are primarily psychological. Option D. Refer the client directly to a psychiatrist for medication management without a prior medical or psychological assessment by the CST. The correct answer is A. Recommend a comprehensive medical evaluation by a physician to rule out underlying physiological causes, followed by a detailed psychological evaluation by the CST to assess for psychological contributors. Explanation. This scenario presents a professional challenge due to the inherent complexity of integrating medical and psychological evaluations in sex therapy, particularly when a client presents with symptoms that could stem from either domain or a combination. The certified sex therapist, CST, must navigate potential diagnostic ambiguity, ensure client safety, and adhere to ethical and regulatory standards for comprehensive care. The challenge lies in determining the most appropriate and ethically sound initial course of action to ensure the client receives the most effective and appropriate treatment without overstepping professional boundaries or delaying necessary medical intervention. The correct approach represents best professional practice because it prioritizes a thorough, multifaceted assessment that acknowledges the interconnectedness of physical and psychological health in sexual functioning. By recommending a comprehensive medical evaluation by a physician, the CST ensures that any underlying physiological conditions contributing to the client's sexual concerns are identified and addressed. This aligns with ethical guidelines that mandate practitioners to work within their scope of competence and to refer clients to other professionals when their needs exceed the CST's expertise. Following this, a detailed psychological evaluation by the CST allows for a nuanced understanding of the psychological factors at play, ensuring that treatment is tailored to the individual's specific mental and emotional landscape. This sequential, collaborative approach maximizes the likelihood of accurate diagnosis and effective, client-centered treatment, upholding the CST's responsibility to provide competent and ethical care. An incorrect approach that involves immediately initiating psychological interventions without a medical workup fails to address potential organic causes, which could lead to ineffective treatment, client frustration, and potentially the exacerbation of an underlying medical condition. This represents a regulatory and ethical failure to conduct a thorough initial assessment and to ensure that all contributing factors are considered. Another incorrect approach, solely referring the client to a physician without any initial psychological assessment or support, might overlook significant psychological distress or trauma that requires immediate therapeutic attention, potentially leaving the client feeling abandoned or misunderstood. This also fails to meet the comprehensive care standards expected of a CST. A third incorrect approach, attempting to diagnose and treat both medical and psychological aspects simultaneously without appropriate collaboration or referral, risks misdiagnosis, inadequate treatment, and potential harm to the client, violating the principle of working within one's scope of practice and the ethical imperative to seek consultation or referral when necessary. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge the presenting problem and its potential multifactorial nature. 2. Consider the CST's scope of practice and ethical obligations, including the duty to assess and refer. 3. Prioritize client safety and well-being, ensuring that potentially serious medical conditions are not overlooked. 4. Engage in a collaborative process, involving other healthcare professionals when indicated. 5. Conduct a thorough assessment, integrating information from various sources to inform treatment planning. Question 14. Risk assessment procedures indicate that a client presents with persistent difficulties achieving or maintaining an erection during partnered sexual activity, reporting significant distress and relationship strain. The client denies any known medical conditions or current medication use that could explain these symptoms. What is the most appropriate initial step for a certified sex therapist, CST, to take in assessing this situation? Option A. Conduct a comprehensive differential diagnostic assessment, exploring potential psychological, relational, and physiological factors, and recommending a medical evaluation to rule out organic causes. Option B. Prescribe a phosphodiesterase 5 inhibitor, PDE5 inhibitor, to address the erectile dysfunction directly based on the client's denial of medical issues. Option C. Focus solely on communication strategies between the client and their partner to address the relationship strain, as this is the primary stated impact. Option D. Immediately initiate a course of cognitive behavioral therapy, CBT, focused on performance anxiety, as this is a common contributing factor to erectile difficulties. The correct answer is A. Conduct a comprehensive differential diagnostic assessment, exploring potential psychological, relational, and physiological factors, and recommending a medical evaluation to rule out organic causes. Explanation: this scenario is professionally challenging because the presenting symptoms of sexual dysfunction can overlap significantly with various psychological and physiological conditions. A certified sex therapist, CST, must navigate this complexity with precision to avoid misdiagnosis, which can lead to ineffective treatment, patient harm, and potential ethical violations. The core of the challenge lies in differentiating between a primary sexual disorder and a symptom of a broader underlying issue. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that adheres to ethical guidelines for client care and professional competence. This involves a thorough differential diagnosis process, which is a cornerstone of responsible clinical practice. It ensures that the CST gathers sufficient information from multiple sources: client self-report, partner input if applicable, medical history, psychological history, to form an accurate diagnostic impression. This aligns with the ethical imperative to provide competent care, which necessitates accurate diagnosis before initiating treatment. Furthermore, it respects the client's autonomy by involving them in the diagnostic process and ensuring that treatment is tailored to their specific needs and underlying causes. An incorrect approach that relies solely on symptom presentation without exploring potential underlying medical or psychological etiologies is professionally unacceptable. This failure constitutes a breach of ethical standards related to competence and due diligence. By not considering or ruling out other contributing factors, the CST risks misdiagnosing a condition that requires medical intervention, e.g., hormonal imbalances, neurological issues, side effects of medication, or a different therapeutic modality, e.g., psychotherapy for depression or anxiety. This can lead to delayed or inappropriate treatment, potentially exacerbating the client's distress and undermining the therapeutic relationship. Another incorrect approach might involve prematurely assigning a diagnosis based on limited information or personal biases, which violates ethical principles of objectivity and evidence-based practice. This can result in ineffective or even harmful interventions. The professional decision-making process for similar situations should involve a systematic approach to differential diagnosis. This includes 1. Obtaining a detailed history, including sexual, medical, psychological, and relational history. 2. Conducting a thorough symptom analysis, exploring onset, duration, frequency, and impact. 3. Considering potential medical causes and recommending appropriate medical evaluation when indicated. 4. Exploring potential psychological factors such as anxiety, depression, trauma, or relationship issues. 5. Utilizing standardized assessment tools where appropriate. And 6. Collaborating with other healthcare professionals when necessary to ensure comprehensive client care. This iterative process allows for refinement of the diagnostic hypothesis as more information becomes available, ensuring that the most accurate diagnosis is reached before treatment planning. Question 15. Process analysis reveals that a certified sex therapist, CST, is working with a client who is expressing increasing confusion and exploration regarding their sexual orientation and gender identity, which has shifted over the course of therapy. The CST is tasked with determining the most appropriate therapeutic response that aligns with professional standards and ethical obligations. Which of the following approaches best reflects the CST's professional responsibilities in this situation? Option A. Facilitate the client's exploration of their evolving sexual orientation and identity, providing a safe, non-judgmental, and affirming space for self-discovery, while offering relevant educational resources as requested by the client. Option B. Express personal reservations about the fluidity of sexual orientation and identity, encouraging the client to consider the potential social and personal challenges associated with non-traditional identities. Option C. Focus the therapeutic intervention solely on addressing the client's stated sexual concerns, while avoiding direct engagement with the exploration of their sexual orientation or identity to maintain professional boundaries. Option D. Gently guide the client towards a more stable or commonly understood sexual orientation or identity, suggesting that such stability is often indicative of successful therapeutic outcomes. The correct answer is A. Facilitate the client's exploration of their evolving sexual orientation and identity, providing a safe, non-judgmental, and affirming space for self-discovery, while offering relevant educational resources as requested by the client. Explanation. This scenario presents a professional challenge because it requires a certified sex therapist, CST, to navigate the complexities of a client's evolving sexual orientation and identity within the ethical and regulatory framework governing their practice. The CST must balance the client's autonomy and self-determination with the professional responsibility to provide competent and affirming care. The challenge lies in ensuring that interventions are not based on personal biases or outdated societal norms, but rather on current understanding of sexual orientation and gender identity, and that the therapeutic process respects the client's lived experience. The correct approach emphasizes the CST's role in facilitating the client's exploration and self-discovery without imposing any particular outcome. This aligns with the ethical principles of non-maleficence and beneficence, ensuring that the client is not harmed by the therapeutic process and that their well-being is promoted. Specifically, it upholds the principle of client autonomy, recognizing that the client is the expert on their own identity and experiences. Professional guidelines for CSTs, such as those established by professional bodies that accredit CSTs, mandate a non-judgmental and affirming stance towards diverse sexual orientations and gender identities. This approach ensures that the CST remains within the scope of practice, focusing on therapeutic support rather than attempting to change or direct the client's identity. An incorrect approach would involve the CST attempting to steer the client towards a specific sexual orientation or identity, perhaps based on the therapist's personal beliefs or a misinterpretation of therapeutic goals. This constitutes a significant ethical failure, violating the principle of client autonomy and potentially causing harm. Such an approach could be seen as practicing outside the bounds of professional competence, as it moves away from facilitating exploration to imposing a predetermined outcome. Furthermore, it would likely contravene professional codes of conduct that prohibit discrimination and mandate affirming care for all clients, regardless of their sexual orientation or gender identity. Another incorrect approach would be for the CST to express discomfort or judgment regarding the client's exploration of their sexual orientation or identity. This demonstrates a lack of cultural competence and an inability to provide a safe and supportive therapeutic environment. Ethically, this failure undermines the trust essential for the therapeutic relationship and can lead to the client feeling invalidated and unsupported, thereby hindering their progress. It also fails to meet the professional standard of providing evidence-based and affirming care. The professional decision-making process for similar situations should involve a commitment to ongoing professional development in understanding diverse sexual orientations and gender identities. It requires self-reflection on personal biases and a consistent application of ethical principles, particularly client autonomy and non-maleficence. When faced with a client exploring their identity, the CST should focus on active listening, empathetic validation, and providing resources that support the client's self-exploration. The goal is to empower the client to understand and embrace their authentic self within a framework of professional ethical guidelines and current understanding of human sexuality. Question 16. Implementation of a comprehensive assessment for a client presenting with concerns about hormonal imbalances affecting their libido and sexual response. The certified sex therapist, CST, must determine the most appropriate initial course of action. The client reports experiencing a significant decrease in desire and difficulty with arousal, attributing these changes to potential shifts in their endocrine system. The CST has a strong understanding of the biological foundations of sexuality, including the roles of hormones, neurotransmitters, and physiological processes in sexual functioning. Which of the following represents the most ethically sound and professionally responsible approach for the CST in this situation? Option A. Immediately recommend a course of over-the-counter supplements known to support hormonal balance and sexual function. Based on the client's self-reported symptoms. Option B. Initiate a detailed discussion with the client about their medical history and current symptoms, emphasizing the importance of consulting with a physician or endocrinologist for a medical evaluation to rule out or identify any underlying biological causes before proceeding with sex therapy interventions. Option C. Begin prescribing specific hormone replacement therapy protocols, drawing upon general knowledge of endocrinology to manage the client's perceived hormonal imbalance. Option D. Advise the client that sexual response is primarily psychological and that focusing on cognitive behavioral techniques will be sufficient to address their concerns, disregarding the client's stated biological concerns. The correct answer is B. Initiate a detailed discussion with the client about their medical history and current symptoms, emphasizing the importance of consulting with a physician or endocrinologist for a medical evaluation to rule out or identify any underlying biological causes before proceeding with sex therapy interventions. Explanation: this scenario presents a professional challenge due to the intersection of a client's expressed concerns about biological factors influencing their sexual functioning and the certified sex therapist's CST ethical obligation to provide evidence-based, client-centered care within the scope of practice. The CST must navigate the client's self-diagnosis and potential desire for specific interventions without overstepping professional boundaries or making unsubstantiated claims. Careful judgment is required to ensure the client receives appropriate assessment and referral if necessary, while maintaining a therapeutic alliance. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment grounded in the biological foundations of sexuality. This involves a thorough exploration of the client's reported symptoms, medical history, and potential physiological contributors. It aligns with ethical guidelines that mandate competent practice, which includes understanding when to consult with or refer to other healthcare professionals, such as physicians or endocrinologists, for medical evaluation. This approach ensures that any biological factors are appropriately investigated by qualified medical practitioners, allowing the CST to then integrate this information into a holistic sexual health treatment plan. This respects the client's autonomy and ensures their safety by not attempting to diagnose or treat medical conditions. An incorrect approach that involves immediately recommending specific supplements or hormonal interventions without a medical diagnosis is a significant regulatory and ethical failure. This constitutes practicing outside the scope of a CST's licensure and expertise, potentially leading to harm if the client's symptoms have an underlying medical cause that is not addressed. It also violates the principle of informed consent, as the client would not be fully aware of the potential risks and benefits of unverified interventions. Another incorrect approach, such as dismissing the client's concerns about biological factors entirely, is also ethically problematic. This fails to acknowledge the biopsychosocial model of sexual health and can alienate the client, hindering therapeutic progress. It also neglects the CST's responsibility to explore all relevant aspects of a client's sexual well-being. Professionals should employ a decision-making framework that begins with active listening and empathic validation of the client's concerns. This is followed by a thorough biopsychosocial assessment, identifying potential biological, psychological, and social contributors to the presenting issue. If biological factors are suspected, the professional's next step is to discuss the importance of medical evaluation with the client and facilitate appropriate referrals to physicians or other relevant medical specialists. The CST then collaborates with the client, and with consent, with other healthcare providers to develop an integrated treatment plan that addresses all identified factors. This process ensures client safety, adherence to ethical standards, and the provision of competent, evidence-based care. Question 17. The assessment process reveals a client from a collectivist cultural background who describes sexual practices within their community that differ significantly from commonly understood norms in Western societies. The client expresses distress not about the practices themselves, but about potential judgment from external sources. How should the certified sex therapist, CST, proceed? Option A. Gently inform the client that while cultural differences exist, the primary focus of therapy should be on universally accepted principles of sexual health, regardless of their cultural background. Option B. Explore the client's understanding of their cultural norms regarding sexuality and how these norms influence their distress, while maintaining a non-judgmental stance and avoiding the imposition of external standards. Option C. Immediately assess the client for potential sexual dysfunctions or disorders, as the described practices deviate from established clinical definitions of healthy sexuality. Option D. Advise the client that their community's sexual practices are likely maladaptive and encourage them to adopt more conventional Western sexual behaviors for improved psychological well-being. The correct answer is B. Explore the client's understanding of their cultural norms regarding sexuality and how these norms influence their distress, while maintaining a non-judgmental stance and avoiding the imposition of external standards. Explanation. This scenario is professionally challenging because it requires the certified sex therapist, CST, to navigate deeply ingrained cultural beliefs about sexuality without imposing their own cultural lens or making assumptions. The CST must recognize that what is considered normal or acceptable sexual behavior varies significantly across cultures, and these variations are not inherently pathological. The core ethical and professional responsibility is to provide culturally competent care, which means understanding and respecting the client's cultural context. The correct approach represents best professional practice because it prioritizes client-centered care and cultural humility. By actively seeking to understand the client's cultural background and its influence on their sexual norms, the CST demonstrates respect and avoids pathologizing behaviors that are normative within that culture. This aligns with ethical guidelines that mandate cultural competence and non-judgmental practice. The CST's role is to help the client explore their own sexual well-being within their cultural framework, not to impose external standards. Incorrect approaches fail to uphold professional standards by either imposing a dominant cultural norm or by making generalizations without sufficient understanding. One incorrect approach would be to immediately interpret the client's description of sexual practices as indicative of a disorder based on a Western, individualistic understanding of sexuality. This is a regulatory and ethical failure because it pathologizes cultural variation and demonstrates a lack of cultural competence, potentially leading to misdiagnosis and inappropriate treatment. Another incorrect approach would be to dismiss the client's concerns as simply a cultural difference without further exploration, which could also be a failure to provide adequate therapeutic support and could inadvertently invalidate the client's experience. The professional decision-making process for similar situations involves a commitment to ongoing learning and self-reflection regarding one's own cultural biases. It requires active listening, open-ended questioning to elicit the client's perspective, and a willingness to be educated by the client about their cultural norms. When encountering unfamiliar cultural practices, the CST should consult relevant literature, seek supervision from colleagues with expertise in cross-cultural therapy, and always prioritize the client's self-determination and well-being within their cultural context. Question 18. The control framework reveals that a client expresses a strong desire for a specific prescription medication to address a sexual dysfunction they are experiencing, believing it will be a quick and effective solution. As a certified sex therapist, how should you best address this request while adhering to your professional and ethical obligations? Option A. Advise the client that medication is not a valid or effective approach to sexual dysfunction and discourage them from pursuing it further. Option B. Directly recommend a specific dosage and brand of the medication the client mentioned based on anecdotal evidence from other clients. Option C. Acknowledge the client's interest in medication. Provide general information about the role of pharmacological interventions in sexual health, and facilitate a referral to a qualified medical professional for assessment and prescription if deemed appropriate. Option D. Attempt to research the medication online and provide the client with detailed instructions on how to obtain it without a prescription. The correct answer is C. Acknowledge the client's interest in medication. Provide general information about the role of pharmacological interventions in sexual health, and facilitate a referral to a qualified medical professional for assessment and prescription if deemed appropriate. Explanation. This scenario presents a professional challenge due to the intersection of a client's expressed desire for a specific pharmacological intervention and the certified sex therapist's, CST, ethical and regulatory obligations. The CST must balance the client's autonomy and expressed needs with their professional responsibility to ensure interventions are evidence-based, safe, and appropriate within the scope of practice. The CST's role is not to prescribe medication, but to provide education, support, and therapeutic interventions related to sexual health. The challenge lies in navigating the client's request for a prescription without overstepping professional boundaries or providing medical advice that falls outside their expertise. The correct approach represents best professional practice because it upholds the CST's ethical duty to practice within their scope of competence and to refer clients to appropriate medical professionals when necessary. By acknowledging the client's request, providing accurate information about the role of medication in addressing sexual dysfunction, and facilitating a referral to a qualified prescriber, the CST is acting ethically and responsibly. This approach respects the client's agency while ensuring they receive appropriate medical evaluation and treatment from a licensed physician or psychiatrist. This aligns with general ethical guidelines for allied health professionals, emphasizing collaboration and appropriate referral pathways. An incorrect approach that involves the CST attempting to provide specific dosage recommendations or discussing the efficacy of a particular medication without being a licensed prescriber constitutes a significant ethical and regulatory failure. This action would be considered practicing medicine without a license, which is illegal and unethical. It also violates the principle of practicing within one's scope of competence, as CSTs are not trained or licensed to prescribe medication. Another incorrect approach, such as dismissing the client's request outright without exploring their concerns or offering appropriate referral, could be seen as a failure to provide adequate care and support, potentially leading to client dissatisfaction and a breach of the therapeutic alliance. It also fails to acknowledge the potential role of medication as part of a comprehensive treatment plan, which a CST should be able to discuss in general terms. Professionals should approach such situations by first actively listening to and validating the client's concerns and desires. They should then clearly articulate their own scope of practice regarding pharmacological interventions, emphasizing that they do not prescribe medication. The next step is to provide general, evidence-based information about the types of pharmacological interventions that may be relevant to the client's concerns, always stressing that these are medical decisions requiring consultation with a qualified healthcare provider. Finally, the professional should facilitate a smooth and appropriate referral to a physician, psychiatrist, or other licensed prescriber, providing any relevant information to the referring provider with the client's consent. This collaborative approach ensures the client receives holistic and appropriate care. Question 19. The assessment process reveals a client presenting with persistent low sexual desire, reporting a history of childhood trauma that impacts their current intimacy and self-perception, and expressing a strong desire to improve their sexual connection with their partner. Considering the certified sex therapist, CST, scope of practice and ethical guidelines, which of the following treatment approaches would be most appropriate? Option A. A combined approach utilizing cognitive behavioral therapy, CBT, to address negative cognitions about sex and self, emotionally focused therapy F, to enhance relational intimacy and attachment security, and sensate focus exercises to gradually reintroduce pleasure and reduce performance anxiety. Option B. A singular focus on couples communication skills training, assuming that improved communication will naturally resolve the issues of low desire and trauma-related intimacy challenges. Option C. An exclusive application of sensate focus exercises, emphasizing physical intimacy and pleasure without directly addressing the underlying trauma or cognitive distortions related to sexuality. Option D. A primary focus on trauma reprocessing techniques, such as eye movement desensitization and reprocessing EMDR, with minimal direct intervention on sexual behaviors or relational dynamics until the trauma is fully resolved. The correct answer is A. A combined approach utilizing cognitive behavioral therapy, CBT, to address negative cognitions about sex and self, emotionally focused therapy F, to enhance relational intimacy and attachment security, and sensate focus exercises to gradually reintroduce pleasure and reduce performance anxiety. Explanation. This scenario presents a professional challenge due to the need to select a treatment approach that is both evidence-based and ethically aligned with the certified sex therapist, CST, scope of practice, while also respecting the client's autonomy and cultural background. The client's presentation of low desire, coupled with a history of trauma and a desire for a partner-focused intervention, necessitates a nuanced understanding of various therapeutic modalities. Careful judgment is required to avoid imposing a singular theoretical framework without considering the client's unique needs and goals. The correct approach represents best professional practice because it integrates a multimodal strategy that directly addresses the client's stated concerns while acknowledging the underlying trauma. This approach prioritizes a client-centered methodology, which is a cornerstone of ethical sex therapy practice. By incorporating elements of cognitive behavioral therapy, CBT, to address negative thought patterns related to desire and intimacy, and emotionally focused therapy, EFT, to enhance relational connection and address attachment issues stemming from trauma, the therapist is employing evidence-based techniques. Furthermore, the inclusion of sensate focus exercises, a foundational technique in sex therapy, directly targets the physiological and psychological aspects of sexual response in a gradual and non-demanding manner. This comprehensive strategy is ethically sound as it is tailored to the client's specific presentation, respects their pace, and aims for holistic improvement in sexual functioning and relational satisfaction, aligning with the CST's commitment to client well-being and evidence-based care. An incorrect approach that solely focuses on a single modality, such as exclusively employing CBT without addressing the relational dynamics or trauma impact, would be professionally unacceptable. This failure would stem from a lack of comprehensive assessment and an oversimplification of the client's complex presentation. Ethically, it would violate the principle of beneficence by not providing the most effective and appropriate care. Another incorrect approach that solely focuses on trauma processing without integrating sex-specific interventions would also be professionally challenging. While trauma is a significant factor, neglecting the direct sexual concerns would fail to meet the client's primary stated needs and could lead to a lack of progress in their sexual relationship. This would represent a failure to adhere to the specialized knowledge and skills expected of a CST. A third incorrect approach that prioritizes partner-focused interventions without adequately assessing and addressing the individual's trauma history and its impact on their sexual self-perception would be ethically problematic. This could inadvertently re-traumatize the client or create an imbalance in the therapeutic process, failing to acknowledge the interconnectedness of individual and relational well-being. The professional decision-making process for similar situations should involve a thorough and ongoing assessment of the client's presenting issues, their history, and their goals. This includes understanding the interplay between individual psychological factors, relational dynamics, and sexual functioning. Therapists should be proficient in a range of evidence-based treatment modalities and be able to integrate them flexibly based on client needs. Ethical considerations, including client autonomy, confidentiality, and the principle of do no harm, must guide all therapeutic decisions. Regular consultation with supervisors or peers, particularly when dealing with complex cases involving trauma and sexual concerns, is also a crucial component of professional practice. Question 20. Investigation of a certified sex therapist approach to a couple struggling with significant communication breakdowns regarding their sexual intimacy and desires. The couple reports feeling unheard and misunderstood, leading to increased frustration and avoidance. The therapist's goal is to equip them with effective communication skills to navigate these sensitive topics. Which of the following therapeutic interventions best aligns with ethical and professional standards for communication skills training in sex therapy? Option A. The therapist tells the couple that their communication issues are common and that they will likely resolve themselves with time, suggesting they focus on other aspects of their relationship for now. Option B. The therapist shares personal stories of their own marital challenges and how they successfully communicated their sexual needs to their partner, encouraging the couple to adopt similar strategies. Option C. The therapist facilitates structured role-playing exercises where the couple practices expressing their needs and listening to each other's perspectives using I statements and reflective listening techniques, providing feedback on their delivery and understanding. Option D. The therapist provides a detailed list of specific sexual acts and positions that the couple should try, instructing them on how to communicate their preferences for these activities. The correct answer is C. The therapist facilitates structured role-playing exercises where the couple practices expressing their needs and listening to each other's perspectives using I statements and reflective listening techniques, providing feedback on their delivery and understanding. Explanation. This scenario presents a professional challenge due to the inherent vulnerability of clients seeking sex therapy and the critical importance of establishing and maintaining appropriate therapeutic boundaries. The therapist must navigate the delicate balance between fostering a safe and trusting environment for open communication and ensuring that the therapeutic relationship remains professional and ethically sound. Missteps in communication can lead to client harm, erosion of trust, and potential ethical violations. The correct approach emphasizes active listening, validation, and the use of clear, non-judgmental language to facilitate the client's exploration of their sexual concerns. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the client's well-being and avoiding harm. Specifically, the therapist's role is to guide the client in developing their own communication strategies within the relationship, rather than imposing solutions or engaging in personal disclosures that blur boundaries. This approach respects client autonomy and promotes their agency in addressing their issues. An incorrect approach that involves the therapist sharing personal anecdotes about their own sexual experiences or relationship challenges is a significant ethical failure. This constitutes a boundary violation, shifting the focus from the client's needs to the therapist's own, and can create a dual relationship or lead to the client feeling pressured to reciprocate disclosures. Such behavior undermines the therapeutic alliance and can be exploitative. Another incorrect approach, such as offering direct advice on specific sexual acts or techniques without a thorough assessment of the client's unique situation and comfort level, is also professionally unacceptable. This bypasses the essential process of collaborative exploration and skill building, potentially leading to ineffective or even harmful outcomes for the client. It also fails to empower the client to develop their own solutions. A third incorrect approach, characterized by dismissive or judgmental language when a client expresses difficulty in communicating, is ethically problematic. This violates the principle of respect for persons and can create a hostile therapeutic environment, discouraging further disclosure and potentially re-traumatizing the client. It demonstrates a lack of empathy and professional competence in managing client distress. Professional decision-making process for similar situations involves a continuous assessment of the therapeutic alliance, adherence to ethical codes, and a commitment to client-centered care. Therapists should regularly consult with supervisors or peers when encountering complex communication challenges and prioritize ongoing professional development in communication skills training. The primary guiding principle is always the client's welfare and the maintenance of a safe, ethical therapeutic space.